And what I'd love to see happen is much more communication and much more cooperation between specialists and primary care doctors, so that patients, once we stabilise them, can then be managed in the medical home.
It's wonderful to have the opportunity to pick up the phone and speak directly with a specialist, and certainly I think it's been hugely beneficial and cuts down on maybe me sending patients to the emergency department, because I can get advice directly. Can often flag patients that I feel are urgent that need to be seen quicker, and they often are seen within the same day. And I think also peace of mind, like certain subtle blood tests that may not warrant an outpatient department, review. It's very often nice to be able to ask a specialist, well, look, I have a patient with this, this and this. Are they someone that you actually need to see, or can we observe it for 6 months, 12 mons?
And about 40% of the calls that I get, I end up seeing the patient. And then, very often the diagnosis is quite clear over the phone. Treatment can be started, the basic workup can be done, and then by the time I see the patient, I just get them onto advanced therapy, and it's a better outcome for the patient. From our perspective as a specialist, it's much better if we have a direct line to the doctor. If the doctor has access to the patient's healthcare number, so we can both look up stuff on Netcare and have a real-time chat about appropriate things.
I review some of the documents that are online with regard to the specialist pathways and highlight appropriate investigations for certain clinical conditions, which I find are very beneficial.
Gout's one of our most common conditions. It's badly managed, and it's very treatable if it's managed appropriately. 2 family care doctors, and myself and Susan Barr, another rheumatologist, and we hammered out this pathway over a period of a year, and it's been one of the most downloaded pathways of all of them, actually. And it's also good that when I see patients with gout and I'm doing the ladder back to the family doctor, I can draw their attention to a recently developed pathway. The service has been a real success. It was initially thought, oh, this is going to be really onerous. It's not. It's about 2 or 3 phone calls a day for our specialty. And recently, actually, we've done a cost-effectiveness analysis of it. On average, each phone call to rheumatology saves the system about $190. But much more importantly, it leads to improved patient care. In general, it's extremely worthwhile.
I would say overall it's been very positive for patients, because they feel that they're getting their diagnosis and treatment much quicker. There's also a reassurance from our point of view that we're getting to speak with the specialists and highlight patients we're concerned about.